What is risk stratification for testicular cancer surveillance? Imagine you've just had surgery to remove a testicle because of early-stage testicular cancer. Now, your doctor needs to decide how closely you should be watched for possible cancer return. That's where risk stratification comes in. It's a process doctors use to figure out how likely it is that the cancer might come back after surgery. This helps them decide whether you need just regular checkups or if you should have extra treatments or more frequent monitoring. Most early-stage testicular cancers, especially seminomas, are treated with removal of the affected testicle through a procedure called radical orchidectomy. After this surgery, many patients go into a surveillance program, which means they are carefully watched for signs of relapse instead of immediately starting chemotherapy or radiation. But not everyone has the same chance of the cancer returning. Some are at low risk, and others are at higher risk. Risk stratification helps identify these differences. To do this, doctors look at several key factors. One important factor is tumor size. Larger tumors tend to have a higher chance of coming back. Another is whether the cancer has invaded the rete testis, which is a network of small tubules inside the testicle. If the cancer has invaded this area, the risk of relapse increases. They also consider whether cancer cells have spread into blood vessels or lymphatic vessels, known as lymphovascular invasion, which can be a sign of higher risk, especially in non-seminomatous tumors. Serum tumor markers are also checked after surgery. If these markers are normal, it suggests the cancer might be less likely to return, making surveillance a safer option. Other features like whether the tumor was multifocal or if there was germ cell neoplasia in situ, a precursor to cancer, can also influence risk assessment. Recent research has improved these models by combining multiple factors to better predict who is more likely to relapse. These refined models help doctors create personalized surveillance plans, adjusting how often and what kind of imaging tests are needed. Typically, surveillance involves regular scans of the abdomen and chest, since the most common relapse sites are in the retroperitoneum and lungs. These scans are usually scheduled more frequently during the first 2 years after surgery, when the risk of relapse is highest, and less often afterward if no signs of cancer are found. In summary, risk stratification for testicular cancer surveillance is a careful, evidence-based way to classify patients based on their chance of cancer returning after initial treatment. It allows healthcare providers to tailor follow-up plans, balancing the need for early detection with avoiding unnecessary tests and treatments. Always remember, each person's situation is unique, so it's important to discuss your specific risk factors and surveillance plan with your healthcare team. Following current guidelines and scientific evidence helps ensure the best possible care and outcomes.